So payments, how are we going to get paid for what we do? Well, there's a bunch of different factors that factor in there, but let's try and demystify some of those. So your assignment option, what we're going to look at there is do you get the check or does the patient get the check? In versus out of network, right? Are you in network? Are you in a contract with that insurance company where you've agreed to take a lower fee, but now they're going to send more patients to you, and those patients are going to have to pay you less? You know, the insurance will pay you more. So you're going to essentially market that way. Or do you want to be out of network where you don't want to have to deal with all the hassle? Certainly both options are very useful and viable depending on your business. Deductible, what does the patient have to pay before the insurance even kicks in? These can be split between family and individual deductibles. One of these has to be met before the insurance is going to kick in. Whichever one gets met first is whichever one is the one that matters. So if families hit first, great, insurance will still pay for that individual patient. Coinsurance or copay. These are two different questions I get often. Which is which? What are these? Think of these as the same thing. Different words, but really mean the same thing. What portion is the insurance versus payment or patient going to pay? These are often, insurance will typically pay more. So if you see it reported as coinsurance of 80%, you know that means the insurance is going to pay 80%, the patient's going to owe 20% once deductible is hit. If you see it listed as 50, well, it's a 50-50 split. If you see it listed as 20, the patient's going to owe you 20%, and the insurance will pay 80%. So kind of an idea there. Again, either way, different words, different insurance companies, but pretty straightforward there. The insurance needs to know who you are. You need a W-9 on file with them. If you've never billed that insurance before, they'll likely ask you for one. So have one ready, pre-signed, and your team can mail that off. You're going to get a check or directly to your bank. That's going to be insurance specific. Their rules in network is almost always EFT. If you've never billed them before, it's probably going to be a check. Most insurances, though, you can, once you have registered with them, even out of network, you'll be able to sign up for EFT if you don't want to manage checks. That's what I'd suggest. Much safer from an embezzlement perspective to have it go straight to your bank account. And then lastly, ERAs or EOPs. This is going to be why you got paid or why you didn't get paid, as it sometimes feels is the only answer there. ERA, electronic remittance advice. It's the insurance basically electronically telling you, here's why we remitted these funds, or here's why we did not remit these funds. EOP means explanation of payment. Same kind of idea. They've gotten away from that term, but think of these as an EOB, explanation of benefits, in the dental world. But all that goes together, and that kind of explains the payment you're going to get from that insurance company.